Hi, everyone. It's such a pleasure to be here with you this afternoon. I have really enjoyed hearing about the work from all of our young innovators, and that's one of the wonderful things about our position is we get to see people at the beginning of their careers and all of the great ideas that they're bringing to solve challenges. But one of the other things that I really love about our design competition is we also take the opportunity to recognize the contributions of leaders in the field who really inspire the work that all of us do. And so it's my pleasure today to present the 2020 Rice 360 Innovation and Leadership Award to our keynote speaker today, Wendy Taylor. Wendy is a fellow at the Rockefeller Foundation, and she's doing really critically important work for our current time. She's using digital health technologies to predict and prevent pandemic threats. But I first met Wendy when she was at USAID. At USAID, she served as the director of the Center for Accelerating Innovation and Impact. And I met Wendy almost 10 years ago, and she really had a transformative impact on my career. And not just my career, but the careers of thousands of people like me. She and the wonderful team that she assembled ran a program called Saving Lives at Birth, which was a grand challenge program to bring together, build a community of innovators who were designing, inventing, and implementing and scaling new innovations to improve maternal and newborn health all over the world. And I participated in the very first Saving Lives at Birth challenge. I learned so much from the programs that were held every year. I made so many important contacts as a result of that. And so today, it's really our honor to recognize all of Wendy's contributions to global health. So Wendy, on behalf of our team at Rice 360, who you have inspired in so many ways, but also on behalf of thousands of innovators all over the world and millions of patients and families whose lives have been improved by the work of that group, thank you so much. We're delighted that you could be here with us today to address our students.
Oh, wow. Well, thank you so much, Rebecca. That really was actually quite moving for me and means a lot. And so, huge thank you to you, to Maria, to your amazing team. I think I would just want to throw the praise and the thank you right back to you. I mean, you have been an inspiration to me. I mean, we sort of dove into a lot of our work early on by being kind of innovators ourselves and trying to experiment. We knew we needed new solutions, and it was really sort of brave and really thoughtful innovators like you that dove in and did it so thoughtfully and with such respect for the communities that you are trying to serve. And so I think we learned as much from you as perhaps you learned from the process. And you continue to be an inspiration. You're not just continuing to, I mean, I'm always amazed by how many innovations continue to come out of your shop through your teams, but you've also been innovating around the entire system and the process, which is so much of the challenge in getting these good ideas to scale. And so you all are kind of the gold standard and an inspiration to us all. So thank you very much. Hello to everybody. It is great to be with all of you virtually. I'm sorry we're not in person, but I really enjoyed taking a look at so many of the innovative ideas that you all have been working on, and I'm really impressed. And so huge props to the Rice team for making this happen, even in virtually, so you could get really your important efforts get proper recognition. So On to my talk, and I have been spending a lot of time in all recent days on the COVID response, and so ended up less time than I thought to pull this together. And I sort of did a big change in the direction I was going to go after spending so much time on COVID innovations and dealing with some supply chain challenges. So what I'm going to focus on is really thinking about how, and I'm going to see if I can share my screen. Let me do that first so I don't mess this up. And go to here. And if I can find the right tools here. Okay, here we go. All right, we switched gears here. Okay, so I'm going to focus on how do we innovate during a pandemic, and I want to be able to bring some of the lessons that we learned from innovating and sourcing innovations during both the Ebola and Zika epidemics. So, just to start off with, I think we've all become immersed in our the current crisis that we all find ourselves in across the world, and we've certainly heard about the critical need for diagnostics and vaccines and therapeutics to aid in our response. But I think equally we've been hearing about some huge supply chain challenges in medical equipment, in things that hospitals need on the front lines. We've got broken supply chains. We've got hospitals who are already running low on supplies, and they are on the front end of that epidemic curve. And so, and we've kind of watching this pandemic move across continents and seeing some of the challenges that are coming, yet really not at all prepared for what we are facing now. But one of the things that we have seen is some really interesting ideas around innovation. And so even looking at China and South Korea and others, we saw some fascinating things, some things I didn't even realize possible. There were drones flying the streets in Wuhan telling residents to get back home, or actually even disinfecting neighborhoods. There are robots that were not just aiding in food deliveries, but aiding nurses and decontaminating hospitals. We saw really cutting edge technology being used to screen patients in airports, and advances in digital surveillance and AI chatbots to be able to help people understand whether or not they're sick, perhaps even aid in contact tracing, or actually some interesting things around surveillance, which we may or may not be comfortable with. But we're also seeing innovation here at home as well. And I actually just read about this morning. There was a University of Wisconsin hospital reached out to the bioengineering team at University of Wisconsin and said, hey, we are running really short on face masks. What can you do to help us? And this, a couple folks there were already in social isolation. We're still managed to get some supplies and did some rapid prototyping, got some quick feedback, had to go back to the drawing board a few times, but ended up coming up with a really simple face mask that just uses 3 different types of materials, and got approval from the hospital. They produced a large volume of them for the hospital, and now Ford Motor Company is actually making those same designs. I think supplying 75,000 to hospitals in Detroit this week, and planning on producing 100,000 a week. So that's pretty simple innovation, but some pretty amazing stories coming out of this. We're seeing a sewing army come on board, for better or for worse. People deciding that they can make masks all over the country, perhaps all over the world, using designs. We don't know whether or not those are safe, and there may be some issues with those, but some pretty impressive mobilization taking place, even in some cases where it's not been asked for. And then, of course, we're seeing hackathons and innovation challenges pop up. Mass General has a challenge ongoing around a ventilator. MIT has its own challenge going, where they're looking to develop an an open source ventilator for $100. There are also existing solutions that have been in development for a long time that just didn't get across the finish line. That one on the lower left is from OneSense, which is a ventilator they originally designed for pandemics, but they could never get a real market or buyer for those, and so they had focused on low-income countries. So there's a lot happening right now. So one of the things I wanted to do was really think about, were there lessons that we can draw upon from our previous efforts to source innovations very rapidly during Ebola and Zika, and really think about how we can make sure we're doing innovation both responsibly and effectively, and how we can apply those today. So I'm going to take you back 2014, West Africa. It seems a bit like a distant memory, since right now last week feels like a distant memory, but back then, many of you can remember, the world became transfixed with this public health crisis unfolding before our eyes, and it was really this escalating crisis across 3 West African countries. And remember reading the reports of hospitals reaching capacity, patients getting turned away, increasing number of deaths, and then of course it hit our own borders and caused great alarm, and really the fear and the public attention intensified. So during that kind of early stages, actually from when those first cases really were reported and at least officially acknowledged as Ebola, the US mounted a whole of government response to be able to contain and stop the spread of this virus. So we knew it was a fight we couldn't lose, and we knew that the best way to control the epidemic and to stop the spread of the virus was to stop it at its source in West Africa. And so all of our attentions were focused on that. And one of the things we started hearing about were workers on the front lines who began to face a number of obstacles in providing adequate care and timely care to their patients. And one of the things we heard about, in fact, the first I heard about it in a meaningful way, was a word coming down from the President Obama, who was quite alarmed with the fact that a lot of the suits that healthcare workers were wearing were clearly not well designed for these hot, humid West African climates, and they were dangerously hot. So healthcare workers would put these suits on, and their core temperature would rise. They would start sweating profusely, drip running down their bodies. By the time they got out of those suits, maybe even an hour later, they would dump their boots upside down, and the sweat would pour out. And really, they couldn't wear those for more than an hour or so before they had to get out of them just to keep themselves safe. But they also were limited, and you can see the ensemble here, limited by these visors, these goggles, which was really their only way to be able to see forward. And those would become fogged over very quickly, often before they even saw their first patient. And then finally, the third challenge was taking off this very complex ensemble and doing it safely and be decontaminated. And that was really where people worried that the risk of potential infection for the healthcare workers came in. So it was clear that this was an area that we needed innovation, and something that the president said, yeah, you need to find a way to help with this. And so my team, as we were leading innovation for global health at the time, said, well, we can jump in. And as we started to think very rapidly about how we could engage, we also began to hear about other problems. And so in addition to the suits, we heard about challenges with testing, getting samples from those who were suspected to be sick all the way back to the labs in perhaps a central facility that was running the tests, sometimes by air, by boat, by roads, and then it might take days to actually even get the results back to the patient. And then finally, even communities were unaware of how to protect themselves and their families. And in fact, many communities in the early on had trouble even accepting that the threat was real. So challenges with PPE, challenges with testing, challenges with public health messaging and accepting that that was a real problem facing us. May sound familiar to you, ironically and sadly. but here, back to Ebola, I mean, this was clearly an area where it was ripe for innovation. And so we had tremendous success with the Grand Challenge model, with Saving Lives at Birth, which Rebecca mentioned, and other challenges. So we were able to say, let's try a challenge for this. And we turned on a dime. We issued a challenge within a week. And I can assure you, for government, that was really, really fast. And so we launched, it was called the Fighting Ebola Grand Challenge. And we did it in partnership with the White House, with the Office of Science and Technology Policy in the White House, with the Centers for Disease Control and the Department of Defense, and all about identifying better tools to help tackle Ebola in months and not years. And it was an all hands on deck effort. We were rallying engineers and entrepreneurs and scientists and students to come up with new solutions to the problems we were seeing. And we created multiple ways for people to engage. So of course we had the Grand Challenge where we could issue up to $1 million for ideas, but we also crowdsourced ideas through this open innovation platform where anybody could post an idea and seek feedback on that idea. And it was a really powerful way just to create a conversation in a kind of focused way, engage people from all over the world. And also really what proved to be the most useful in this case was to surface some existing solutions that didn't necessarily need a challenge, but could perhaps be deployed in other ways. And then we also hosted our own hackathon, or really a sort of a brainstorming prototyping workshop specifically around the PPE. We did that in partnership with the White House. And this was, we didn't just bring together the DuPonts and the 3Ms, kind of the big manufacturers of PPE. We brought in sportswear companies and people with cooling solutions and makers and designers into this effort. And the most important thing, and really this is the most important thing when thinking about hackathons or workshops like this, is that we had Ebola doctors who brought that critical user perspective, and they were able to tell us the challenges with using these suits, and were able to provide real-time feedback on ideas as they surfaced. So that was great. We learned a lot from that. But then one of the really exciting things we didn't expect, the hackathons and these workshops popped up all over the country to be able to look for new solutions, including one at Johns Hopkins. And I saw Youssef Yazdi in on your chat message, and he led a really successful one through Hopkins, which I can tell you about in a second. But we had 1,500 ideas come through all of these different platforms. So our daunting challenge then was to figure out how to sift through all of these very, very quickly, really in record time. We didn't sleep for days, I promise you, but we knew we needed to work faster than the crisis. And so I'm going to give you just kind of a quick snapshot of the kinds of things that we found. We invested in a couple of completely reimagined suits, including one from the Johns Hopkins team that came from their hackathon, which completely reimagined the suit ensemble, making it much easier to don and doff these suits, and potentially safer for the healthcare workers. There were cooling solutions that came through that open platform, which we didn't invest in, but we worked with another partner to be able to vet and test the ideas, and that partner in Seattle, with funding from Gates, deployed a number of cooling solutions. Then there were a range of healthcare worker tools, and one of my favorites was actually this wearable sensor that could be used on patients directly. It was disposable. It could provide key vital signs from temperature, oxygen saturation, heart rate, and a number of other metrics. They could wear it while in the red zone, and it could be monitored remotely by healthcare workers. But we also saw reimagined care setting, whether it was different ways to cool a tent or rapidly deployable kind of emergency healthcare units. And then one of the other things that we really didn't imagine at all were new innovations around decontaminants, and we got a couple from that as well. The one pictured here, I called it the human car wash. So instead of getting sprayed down, you could just walk into this sort of small little room and get decontaminated quickly. So we had a lot of ideas come through this process. We invested in 14 of them, but we also knew that sourcing these innovations was not enough. And we needed to be able to our real objectives was getting solutions into the field as quickly as possible. And we know that even under normal conditions, in the best of times, with the best of innovators, there are huge challenges to scaling these innovations. And hopefully you all have heard of all of these, but I'll just mention them. Everything from understanding the market, and many of our innovators that we have funded across multiple challenges really kind of lacked that sort of skills and resources to be able to understand and identify their target market and align with those market realities. I'll throw in here also really deeply understanding those end users, the customers, and the buyers. The entire all of the various players along the way that have an influence on your product, but also finding the right pathway to scale, and that's. One is even just how to operate in these developing country markets, but two is even just being able to figure out what is the right business model. If you are a student innovator or your innovation coming out of a university, is your plan to launch your own social enterprise and take the idea forward yourself? Or do you want to license that technology to someone else that can? And making that decision at the right point in time. You also need to have the right team in place with the right skills to be able to make these decisions depending on which path you follow. And you need to be planning for product introduction really at almost the earliest stages of when you start development of your product, and even as you're thinking through the prototypes and you kind of beginning that process with the end in mind and planning all the way along. You need to raise the funds, which is always a challenge, and also bring on the right partners at the right time. And that can include everything from a partner that might help you test in your target markets. It might be that same partner could help you scale your innovations later. It might be a manufacturer that you want to bring on board early on. And so all of those pieces are really, really important. So that can really slow down the development process. But we knew if in this case, as we were innovating in an emergency, and we wanted to put these solutions into healthcare workers' hands quickly, we needed to smooth all of those challenges out and try to smooth that pathway as much as possible. So, so one of the things, of course, we did was infuse that quick cash to take the cash challenge off the table. But we also did a whole host of other things, from helping our innovators get access to testing sites. So this is that, I called it the Smart Band-Aid. That was my own term for it, but you can see we helped get that into testing in Sierra Leone. You can see the individual sitting there was a patient testing out that wearable sensor, and got a lot of really important feedback from that. The other is even helping get critical user feedback. This was one of these deployable emergency treatment facility. The team from Baylor originally thought about actually using shipping containers to have rapidly deployable treatment facilities. And they're ubiquitous in many parts of Africa. Yet they heard very quickly that those were really not easy to move, too big, not nimble. They needed something lightweight that could be compact. So they redesigned the whole thing, and you're seeing play out right here, a team of 4 people be able to set up this, this emergency facility that could be used very, very quickly, and just did it in about 5 minutes. In addition, is building partnerships, and here's where Yusuf gets another shout out. So the team at Hopkins developed this really exciting new design for the PPE. And one of the things that we helped do is bring in DuPont as a partner. And in fact, we brought a lot of those manufacturers in even at the early stage. So just like you guys did today, we had a pitch competition for many of these innovators and had a lot of the manufacturers in the room so that we would have them there at the start of the process. And that was, I think Yusuf and others can talk about how helpful it was to have that manufacturing partner there early with them. And then, oops, sorry, I didn't take that extra slide out. And then finally, even working to connect innovators to the key influencers and buyers. So we worked with WHO. They hosted several meetings for the innovators. They brought in individuals from ministries of health, many countries, to be able to see these different products, provide feedback, but also to raise awareness that they would be coming down the pike soon. at Médecins Sans Frontières, which is one of the real leaders in Ebola response, hosted innovators at their mock Ebola treatment unit in Brussels to be able to review all of these innovations together and see which ones actually worked really well for them. So, and then even beyond that, we anticipated challenges with having to change protocols and that would be necessary for procurement or regulatory challenges for some of our innovators. So our team was also working on that end to be able to work through those and influence those who are in a position to change things, even going so far as to hire a consultant to sit at WHO to develop some of the new standards around the PPE that would be necessary for procurement. So all of these efforts are really, I think, helped move the needle. So I just want to quickly be able to think through some of what we learned that can help today. And I'm going to go through this fast because I know I'm running short on time. So one thing is, on the innovation side, on sourcing innovation, we certainly knew and I think kind of reinforced that grand challenges are a really effective tool at being able to source ideas quickly. It's a sort of galvanizing event, creates this all hands on deck moment. And it was amazing how many people were able to respond and generate ideas very, very quickly. The other thing I'll mention is that, it's nothing like a crisis to be able to break down barriers and working together. And that was true even within the federal government. And we, this whole of government approach, we had that with the challenge as well. And agencies work together that didn't worry about turfs and turf issues, and everybody can roll up their sleeves and provided input and feedback and work collaboratively. And I have to say, it was one of my proudest moments working in federal government to have that come together so well. But I also mentioned, how you ask for ideas makes a big difference in the diversity of the ideas you get. And if we had only done a prize for a suit, we would have missed out on a whole bunch of great ideas. And I pulled up this other reminder that we actually did a second challenge around combating Zika. My original intent had been to do a grand challenge for future threats, because we felt like we had proven that we can source innovations in a crisis, but boy, it's a lot better to do it when you're not in the middle of a crisis. But we couldn't actually get any money, ironically, for preparedness. And so it wasn't until Zika came along that we were able to get the money, and we sourced ideas both for Zika and future threats. But through that challenge, saw a lot of innovative ideas in areas we also couldn't have imagined. And then I'll also mention that good ideas can come from anyone and anywhere. And the Hopkins team ended up getting a lot of great mileage to the fact that they had a wedding dress designer as part of the sort of wide, sort of diverse array of thinkers that were part of their original hackathon. Bringing unlike minds together can create new ways of thinking. But also, one of our most successful innovators came from perhaps an unlikely place. On the right-hand side, you see these were college seniors at Columbia University that developed that colorized bleach, which I'll show you in a second. And it's been one of our most successful innovations. They created a business as soon as they graduated and have been flying high ever since. And here the Keynote is on the right. It's a colorized additive to bleach that you can use and make sure that you are effectively decontaminating the surface, whether you're spraying down a healthcare worker or spraying a surface or even wiping a surface. And so I actually highlighted both of these. These were two of our most successful innovators. The other one is Shift Labs with just a battery-powered drip monitor to be able to control IV fluids. And I put them up here because as I walk through some of the lessons in scaling, a lot of the things that I will point out were things that these two groups actually got right, and one of the reasons why I think they've been so successful. So here is my top 6 list to run through quickly. So 1, user feedback is critical, always, 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 even in emergency. And the innovators that I showed you that were super successful were ones that listened. They iterated based on what they heard, and they changed their products based on that, and really made sure they were designing products for the right users in ways that would work. Second, keep it simple. don't over-engineer a solution, and that's important for speed to market. It's important when thinking about adoption and scalability. And I can tell you one of the innovators that didn't do well was one that really was focused more on a lot of the bells and whistles. That's really what they wanted to do, but it was not what the market needed, and they had a real challenge in actually bringing that idea forward. But also, don't reinvent the wheel if you don't have to. And I think that's a good lesson in frugal innovation. It was a good lesson for a lot of the information technology, digital tech solutions. There's a lot of ideas already out there. And as we even look at solutions today, there may be things that we can tweak much more easily than starting from scratch, and move them faster. And then third, partner early, whether it's the NGO that's helping you get access to and get on the ground to test, if it's bringing your manufacturer in early, if you've got the manufacturer at the table as you're going through the design, they may be able to steer you in the right direction so that when you make the handoff to them, they're not going back and having to redo things because you didn't anticipate some things that they happen to know about more efficient ways to manufacture a product, or where costs might come into play. And then also don't underestimate how long R&D takes. It takes a long time for many of the reasons we've talked about. But one of the things I'll point out is that testing in a crisis is hard. So even if you get access to the sites to be able to test, healthcare workers are under a lot of stress. They are trying to save lives. They may be lacking on sleep, and one of the last things they want to do is do research. And it's a real challenge, but for a lot of these new solutions, it's really the best time to figure out whether or not they work, and we need to know whether they work to be able to push them forward. But it creates certainly creates some challenges. And then next, markets matter. Markets matter a lot, and particularly if you want sustainable solutions over time. The two that I showed you, Shift Labs and Keynote, were two social entrepreneurs that very quickly were able to figure out alternative use cases for their products in some of those same markets, but they also figured out use cases in high-income markets. So they had dual market opportunities. And they were able to then attract some robust financing, impact financing, venture financing as well, to move their products forward. And those were the two innovations that were used in the DRC and the Ebola, most recent Ebola outbreak. And both of those are actually solutions that may be relevant in the current pandemic as well. And then finally, just anticipate and remove roadblocks. Have your partners remove roadblocks. Have your donors remove roadblocks. There are going to be things that you never thought of that slow the process down. And the more that we can anticipate the entire pathway and figure out what we can move forward, the better and the faster we can move, and the more chances we'll have something in the time that we need it, or at least will be available for the next crisis. So I'm going to stop there. I probably went longer than I needed to, but I'm going to open it up for questions from all of you. I'd love to hear your thoughts and what's on your mind. So thank you.
Thank you, Dr. Taylor. We are all social distance clapping for you right now. Thank you so much for sharing these lessons and advice. We do now want to open up questions from students, from judges, from other guests, again by raising your hand. And I see Christine has a question, so I'll ask you to unmute for your question.
Hi, thank you so much for your wonderful keynote speech. When gathering user feedback and determining partners, how do you decide on what markets to enter? Like, how big of a scale is too big or too small? What are your deciding points for that?
I think, and it's a great question, because I can tell you, even from innovators that we worked with in the past, it's really important to choose your initial target market. So I'll give a couple of thoughts. I know members of my team that worked really closely with a lot of innovators would probably have other ideas to add to this, but I can tell you that that one is you want to be able to get into a market and get into somewhere where you can actually test your product with, and in the kinds of settings where you want to use it, and you're, in doing so, you're building the local connections. You're building connections with, and if we're talking developing countries, with the Ministry of Health that may be critical for scaling those innovations. And we did see a few innovators find some partner just because they had a relationship. It might not have been the right testing site. There might have been conditions in that country that were really not amenable, whether it's policies or the number of patients that they needed in a particular area. So you choose your site poorly, it can be a real challenge for testing, but also it helps, you're building a lot of goodwill and buy-in to be in a place where you have a chance of actually scaling well initially. And so you really have to think through not just where's the best place to test, where can I build partnerships and relationships, and where could I potentially not just develop that proof of concept, but even get some kind of ground, lay some ground in terms of scaling that innovation. So it requires thinking it through multiple steps ahead.
Thank you. I know that Scott Key has a question. Scott, can you unmute?
Yeah, hello. Hey, my name is Scott Key. I run a social enterprise that actually has been awarded USAID DIV funding in the past. My question is about procurement. In your presentation, it seemed like there were a lot of idea opportunities, but then procurement seemed to go very often to groups like DuPont. And I guess my question is, how can USAID and other institutional groups help guide young social enterprises that don't want to license their technology and actually want to take it all the way?
Yeah, and I will say, well, DuPont didn't actually end up moving that innovation forward for a host of other reasons, but I think one of the things that USAID did when I was there was really be able to open up opportunities for innovators, for social entrepreneurs that were not the big players, to be able to compete and move their ideas forward. And we created accelerators to be able to help a lot of the smaller social entrepreneurs who are kind of new to this be able to figure out and find their way through the process. And DIV, which you mentioned, that Development Innovation Ventures was one of those mechanisms that was really intended, like Grand Challenges, to not just give money to the usual suspects, the big players, but to open it up. And I think some of that has continued under USAID under this new administration. And I think those kinds of efforts, in my view, our efforts to do that, to open it up to a whole new range of solvers, new entrepreneurs and innovators, has really opened up the landscape. We've built entirely new creative pipelines and solutions that have changed landscapes and are changing lives. And so this is my way of saying that I think the process has switched a lot toward innovators like you. That is not to say it's not still hard. I know that still the funding out there is still feels few and far between, and we need a lot more of it. But keep at it. It's really important.
Karen, I think we have time for one more question.
Wendy, are you back?
I'm here. No more questions? Can you guys hear me?
I'm sorry, we have one more question. I think I got kicked off somehow. Roger has a question. Go ahead, Roger.
Wendy, I thought that was a terrific presentation with all the ways that innovation can be brought into a problem like that. We're involved now, enmeshed in this COVID outbreak, and there are going to be hackathons coming. Insights into how to do that or experience that you brought from your other hackathon to something like this that's going to be occurring now and probably in the near future. Lessons learned, I would guess. and the use of local people, because most of the problems that we're interested in what's happening in Africa, and much of the innovation will have to come locally, but with some stimulus from outside, whoever has good ideas. Give us your thoughts of how to do that.
And you cut off a little bit, but you were asking, yeah, and is that Roger Glass that I recognize your voice?
Yep, it's amazing.
Okay, hi Roger. So you're saying you all are thinking about for COVID potentially doing hackathons or challenges, and particularly you're thinking about developing countries?
Yes, exactly. In Africa, we're really concerned about Africa as the next frontier of this. How do you organize this? How do you go about it?
Yeah, I mean, so one of the things with the grand challenge is, and the beauty of it is you can sort of move fast and put out a call, design it well so you get lots of different ideas. You say that you're interested. This could be a grand challenge that's issued for COVID that is partnership with NIH and other parts of HHS, CDC. You could have USAID as part of this. You could have the Office of Science and Technology part of it, and a signal that you're interested in solutions both for developing countries with low resource settings as well as solutions here in the U.S. And you're looking for a range of different solutions. And so my suggestion is, one is to cast a broad net, because there are solutions that you might not have thought about, and then you also have to think about, there might be things that that would have worked really well in before, when we're not in this social isolation world. So how do you do hackathons when you can't put everybody in the same room together? There might be ways to still do it, and ways to organize the thinking. There could also be you want to be able to get ideas and think about if there are supply chain challenges, are there solutions that developing countries can either develop on their own, or using open source innovation can manufacture on their own, or they could develop them sort of kind of for so continent wide, and share across. So I think, and I'm happy to have conversations with you offline to think about how to do that and how to draw lessons. It is, I think it would be a great idea to be able to think about where's our role for innovation, in addition to thinking about what are some open source solutions where we just need to actually have market shaping solutions to incentivize local manufacturing, because we're never going to be able to get the supplies there because the supply chains are broken, or our planes are not moving, or whatever it is. We have to anticipate further shutdowns. And so it's going to require a lot more creative thinking, but I think it would be an important effort to move very quickly on, and you might get some great ideas.
Thanks.
Sure.
All right. Thank you so much, Dr. Taylor, for your incredible